Dear everybody, I think it is time to start the event. And it is my great pleasure to be here on behalf of Sustainit at the University of Oslo. And I'm very happy to see you here and welcome you here to this seminar. In brief, Sustainit bridges the Center of Sustainable Healthcare Education, the Center of Global Health, and the Center of Pandemic and One Health Research, which is my own center. What is our joint mission? In sum, we want to contribute to improving health globally, and our main tool is research. Research spanning the full range from research on global health terminology to practices fostering sustainability in the healthcare sector and to basic research on immune responses against vaccines or infections. We are indeed a very multidisciplinary group of people, and in sum, we aim to build a knowledge platform that will enable critical and rational planning and decision-making on challenges related to health and sustainability globally. At present, working together across different nations may seem a bit more challenging than before, maybe. One of the threats that we often talk about are the nationalist movements gaining traction in Europe as well as in other countries. I am terrified of this. Yet, I think it is important that we as scientists, we keep our curiosity of the world and try to understand the basis of why we are seeing such movements. A challenge is also that the science and what we can consider facts seem to have lost credibility in some parts of the population. How can we regain this trust? I don't have the answers today, but we need knowledge to build and secure our future. Research is the key, the best strategy for understanding a complex world. Research and scientific knowledge is also constantly on the move, continuously being updated as new understanding is brought forward. I very much look forward to listening and talking with you all here, and am curious to hear from our esteemed presenters on how we can become better at positively contributing to the geopolitical landscape of today. A big and warm welcome to all of you on behalf of Sustainit. And now I'm proud to give the word to the Vice Rector of the University of Oslo, Mette Halskov Hansen.
Dear Minister, Excellencies, dear friends and colleagues, it's really a great pleasure to be here today and to welcome you all to the University of Oslo. First of all, I would like to thank the Ministry of Foreign Affairs for initiating this important event, and also our colleagues at Sustainit for collaboration and for organizing it. The University of Oslo has established this room and this whole building here as what we call the Scene Domus Bibliotheca, and we decided a couple of years ago to try to have such a place in the center of Oslo, where we are open to dialogues, discussions about all the burning issues that we encounter in our society today. Global health, of course, is one of them, and it's an issue which requires solid scientific knowledge, international collaboration and innovation, and universities, of course, must contribute with basic science, interdisciplinary research, and creative forms of teaching. To do this, we need very good and close communication and also collaboration between the public and private sectors, civil society and academia. And we really try in our rector team and the whole university to promote and also prioritize this at the university today. So I'd like to mention just a few examples of this. Sustainit, of course, we just heard about it. We are very proud to have this unit and these centers at the university. And many of you are probably also familiar with the HISP Center we have in partnership with the World Health Organization, NORAD, and the Bill and Melinda Gates Foundation, to name a few. HISP has developed a software system that has transformed the collection and use of health data in developing countries, and it has benefited millions of people. Last year, they launched a new action research program to support climate-resilient health systems. And finally, I would like to mention also that on June 1st this year, our university will open a brand new Center for Global Sustainability. This will be a new kind of flexible organization within the university, open to anybody outside of the university, and it will be placed at the heart of our campus. It will bring together researchers, students, partners from all sectors in society to work on issues of sustainability. We are very happy that Sustainit is one of the key partners in the Center for Global Sustainability, and I hope that many of you here will come to the center and also be interested in working with our colleagues there. I really look forward to the presentations and the discussions this afternoon, and again, a very warm welcome to the University of Oslo. Thank you. I now give the word to Tove Grandal, who will take us through the program.
Thank you so much, and thank you for hosting us here in this beautiful library. My name is Tove Gravdal. I'm a journalist, but I'm asked to guide you through this event this afternoon, and I have learned a lot preparing for this, and I'm looking forward to learning even more over the next couple of hours. Our interdependence, bringing us together into a common global home across the oceans and the continents, demands that we all combine to launch a global offensive for development, prosperity, and human survival. These are the words of Nelson Mandela, said at the World Economic Forum 33 years ago, and quoted by South Africa's President Cyril Ramaphosa in Davos this week. South Africa, under Ramaphosa's presidency, holds now also the presidency of the G20, which is a group of 19 countries and 2 regional organizations, the European Union and the African Union. And the G20 was established in 1999. It represents 85% of the world's gross domestic product. And global health is definitely a question of human survival, to use Mandela's term. It's a question of basic human rights and human dignity, and it is also a highly contentious political issue. And as the geopolitical landscape is now changing rapidly, what challenges lie ahead within global health? That is one of the questions that we are going to discuss today. G20 health ministers, they have already set a range of ambitions in their Rio de Janeiro declarations from October last year. And one of them is to improve essential health services and health systems to better than pre-pandemic levels in the next 1 to 2 years. So it's urgent. We are less than 2 years away from that goal. And we will hear more about how that goal can be achieved and other goals as well. Norway is a G20 country, guest country this year, like last year during the Brazilian presidency. And global health is a priority for Norway. The annual contribution to this field is approximately 5.5 billion kroner, which is equivalent to $500 million. And if we add humanitarian aid, it's even more than that. And this funding is part of the portfolio of Anne Beate Tvinnereim, who has been the Minister for International Development for 3.5 years. She's also the deputy leader of the Center Party, so she's really busy these days. And she will now outline the Norwegian perspective on global health as a G20 guest country. Tvinnereim, the floor is yours.
Thank you, Tove, and distinguished guests, friends, ladies and gentlemen. Thank you for the invitation. Thank you for putting global health on the agenda, and not only the challenges, but more importantly, the opportunities that we have at fostering these ideas and opportunities under a G20 presidency of South Africa. So let me thank the University of Oslo and its Sustainable Health Unit for co-hosting this event. So this discussion is timely, it's important. I hope that we today can stimulate new thoughts on how to bring the agenda forward in a time of tense geopolitical complexity. As was mentioned, global health is a high political priority for this government, and it has been for many Norwegian governments before this one. It has been a priority across political parties over time, and that has built a reputation for Norway as a global leader of and a generous donor of or for global health. And health cooperation has always been a part of Norway's international engagement. But our modern day and major efforts in global health started with Gro Harlem Brundtland during her time as head at the WHO. Standing on her shoulders, many colleagues have continued to strengthen Norway's leading position in efforts to solve global health challenges. And just like we have always done, we continue to adapt to the changing needs and changing circumstances that are out there. And the University of Oslo, too, has played a very important role through research, through teaching and training with sister universities and institutions in many developing countries. Also through the Health Information Systems program that is familiar to most of you, I'm sure. More than 80 countries have now adopted the DHIS2 system, which was developed here at this university, a remarkable achievement. Dear friends, it's been 5 years now since the outbreak of the COVID-19 pandemic. It's been 3 years since the Russian aggression against Ukraine. 2 years since the fighting erupted in Sudan and in Gaza. 4 days since the inauguration of a new American president. What is the situation of global health against that geopolitical backdrop? The pandemic gave renewed attention to global health in multilateral as well as other international fora, such as G7, G20, EU, AU, and with countries such as South Africa, Brazil, the US, Germany, France, India, Indonesia, and China in the lead. Still, the global health architecture is not optimal and should be reformed, with the aim of avoiding fragmentation and overlapping roles, institutions, and investment instruments. The widespread practice of channeling funds mainly through focused global health initiatives has proven to be inadequate. We have witnessed outbreaks of new epidemics, notably the Mpox, the Marburg in Africa, and unfortunately, others are likely to follow. So what can the G20 do differently? Last year, Norway was invited as a guest country, which was mentioned by Tove, during the Brazilian G20 presidency. We are very proud to have received the same honor and invitation from South Africa this year. And this gives us an opportunity to take part in and shape the current discussions on global health. The G20 is neither an international organization, it's not a private foundation, it's not a global fund. The G20 has no money to distribute and barely a mandate to fill. But the added value of G20 is its convening power. The world's largest economies come together to seek and discuss solutions to global problems. It can help find common ground on the issues that otherwise get politically stuck in more specialized forums sometimes. And as we have seen, G20 can take initiatives. The Pandemic Fund, rooted in a G20 initiative, is today a reality. Another creation is the Joint Finance and Health Task Force, which was set up in 2021 to bring together the finance and the health ministers of the G20 members. And as a side note, we all know that when we get the finance ministers on board, that's when things start to happen. G20 was also an enabler of Act A, with the aim of mobilizing and financing equal and fair access to vaccines during the pandemic. The initiative was led jointly by South Africa and Norway, and it's now taken forward in the Johannesburg process. One landmark achievement under that initiative was the establishment of an mRNA hub in Cape Town, and I was fortunate to attend the inauguration in 2023, and I believe the development potential of that initiative and other like it is significant. So, where do we go from here? First, the way global health actors, donors, and partners countries cooperate, prioritize, and communicate needs to be more efficient and contribute to strengthening national health systems. I'm going to repeat that sentence because it's very important. The way global health actors, donors, and partners cooperate, prioritize, and communicate needs to be a lot more efficient, and it needs to contribute to strengthening the national health systems. Did you get it this time? Yeah. Because that's the core, isn't it? Known to all of you in the audience is the Lusaka Agenda. I'm proud of the groundbreaking work that my colleagues did in partnership with the Kenyan government on this issue. And together we led a bold and unique process to rethink the way that the world approaches global health financing. To better meet changing needs and contexts, and to ensure that we fulfill the pledge of leaving no one behind. We also need to find a more coordinated approach to replace the fragmented structures of today. Long-term capacity building is needed to align global health initiatives with national systems. And that brings me to the second issue. Resilient national health systems are crucial for the country's ability to manage both communicable and non-communicable diseases, as well as other health crises. And access to vaccines is of limited value if there is no functioning system in place to distribute and administer them to the population. Third is access to medical countermeasures. As mentioned, Norway is working with South Africa in the Johannesburg process to ensure equitable access to medicines, vaccines, and other health products. We are fully committed to a successful outcome of the negotiations of a pandemic treaty, currently underway in the WHO. However, consensus has yet to be reached in that process, and full ratification will nonetheless take many years. Unfortunately, the next pandemic does not wait for a treaty, which is why access to medical countermeasures is a global health security issue that needs sustained political attention and action. Then there is the issue of local and regional production of vaccines. This is another area in which G20 has shown leadership, most recently under the Brazilian presidency. The declaration from the health ministers meeting in Rio in October proposed the establishment of a global coalition for local and regional production, innovation, and equitable access to vaccines and other medicines and health technologies. It's now up to the South African presidency to take that initiative to the next stage, and Norway will continue to throw our weight behind it. Dear friends, health is a matter of life and death. With the right policies, good coordination, and effective resource mobilization, we have the potential to reach really far. What those policies are, what good coordination means, and how we can secure effective resource mobilization are discussions that we need to continue both locally, nationally, regionally, and globally. And the G20 really has an important role to play in that regards. Before concluding, let me add a reference to the changing and challenging geopolitical landscape. As you all know, just after taking office, the new American president declared his intention to pull the USA out of the WHO. On this, just let me state that the WHO is the most important coordination platform for solving the world's health challenges and the crisis. An American exit will have serious consequences for the organization and for global health. But the US has been a champion and a strong ally on global health for a long time. We hope to continue our collaboration on global health issues and other issues. And let me just say that at that background, the G20 will not be of less importance in the coming years. I look forward to inspired discussions here today, enriching perspectives, valuable advice from today's speakers, panel members, audience. Thank you for your patience. Thank you.
Thank you so much, Minister Tvinnereim. And we will follow up on some of these points in the panel discussion. I could just add, yes, Trump has withdrawn the US or will withdraw the US from the World Health Organization, but his appointed ambassador to the UN, Elise Stefanik, she said in the hearing in the Congress a few days ago that she wants the United States to remain a leader on global health. So that is another signal coming from Washington now. We will have a panel discussion following up on this, but before the panel discussion, I'm happy to introduce today's keynote speaker, Omnia El Omrani. You are very welcome to Oslo on this snowy day. El Omrani is an Egyptian national and a trained medical doctor, and she is a climate and health policy fellow at the Imperial College in London, which is one of the world's leading universities. Currently, she's doing research at the Oxford University, which is also a leading university. And she was the first youth envoy to the UN Climate Change Conference, the COP27 in Egypt, a few years ago. And that is a position that has been institutionalized since then. And she was also health envoy to the COP28 the following year. She's also a member of Lancet commissions, etc., etc. I'll stop there. There is more to say about you, but we are very pleased to welcome you here, and the floor is yours. Thank you.
Can you hear me? Yes. First of all, dear Minister, Your Excellencies, thank you so much for this incredible opportunity to deliver the keynote remarks for a critical event. And in 2019, during my final year of medical school, that was the first time I was invited to come speak here in Oslo. and it was the launch of the first ever international development strategy aimed at tackling non-communicable diseases in low middle income countries. And I was very inspired by this event when I came back to Egypt, because seeing Norway's leadership and commitment to international cooperation, recognizing that less than 1.7% of global development aid go to non-communicable diseases, and creating a strategy to address that. And B, it made me realize personally that my responsibility as a medical doctor does not lie towards just the individual patients, but towards the global community and the planet which sustains us. So now, in 2025, 6 years later, the world for me has become profoundly different. International crises have reshaped the global aid landscape, and many major donors have undercut their funding, which has ripple effects across the most vulnerable countries. The United Nations has shown this year that only 17% of the Sustainable Development Goals are on track towards the 2030 milestones that countries have committed to. We now live in a world where we have seen how the COVID-19 pandemic have exposed health inequities, where developing countries during the first vaccination rollout were only able to cover less than 10% of their population. We're also living in a world facing 56 conflicts, according to the Global Peace Index of 2024, and the alarming reality that the UN is facing with funding gaps as well as the declining trust. And lastly, we live in a world that has reached 1.5 degrees Celsius officially in 2024, and developing nations that have contributed the least to the global carbon emissions are bearing the most costs on their health and on the well-being of their communities. So when I started my medical training and I was doing my residency in Cairo, not a single day would pass without a child presenting with an exacerbation of an asthma or a lung infection or a pneumonia because of the high levels of fossil fuel-driven air pollution in the city of Cairo. And most of them were children and young people. And I saw how these impacts have led to detrimental effects on their growing brains and their body, as well as exacerbating the existing burden of non-communicable diseases, which I know Norway has been leading in halving premature death by 2050. So global childhood mortality, yes, have halved since 2000, but at the same time, more than 1 billion children around the world are now living in extremely high rates of climate-related disasters. And this graph was done by the IPCC, the Intergovernmental Panel on Climate Change report, which shows that a child who is born in 2020, compared to their grandparents who were born in the 1900s, are going to experience 4 to 8 times the rate of climate-related disasters, which is not only impacting their health, but also their access to education, healthcare services, food and water, as well as their mental health and well-being. In addition, climate change is also disrupting conditions for mental health and well-being in the sense of food and water insecurity, migration, forced migration, disrupted education, but also the awareness of the climate crisis, the awareness of the intergenerational injustice and the world that young people are going to inherit. Seeing headlines saying that we only have 2 years to save the planet. And another study that was done by Google was looking into how many times climate anxiety was searched, and it has been a very high, significant increase in that compared to a period in 2017 to in 2023. And at the same time, when we look at the global climate finance architecture, only 6% of adaptation finance, as well as less than 0.5% of multilateral climate finance, goes to health-related projects that address and build the resilience of healthcare systems to climate change. We are running out of time, but not out of options. And I would love to give an example of how my organization was looking into the mental health impacts of climate change, particularly on the most vulnerable communities, including children and young people, but also looking into indigenous communities, farmers and fisher people, as well as those who are living in the most vulnerable settings. We were funded by Wellcome Trust, and we gathered 900 experts from 90 countries across research, policy, and education to understand the lived experience as well as the research of how climate change affects mental health and well-being. After doing a series of 21 dialogues across 7 regions, both in person and online, we were able to gather and to develop an agenda for the global health community to understand how to research, how to respond to the mental health needs of people in a changing climate. But more importantly, we were able to identify community-led solutions that address, that build the mental health and resilience of communities. One example of this incredible farmer in Kenya that decided to pursue mental health and a degree in psychology to go back to her village where farmers are experiencing depression and suicidal thoughts because of crop failure, because of water insecurity. She goes back and she builds back their resilience, especially for women farmers. The second example I would love to give is in Jordan, where an incredible organization installed solar panels in refugee camps to provide a sustainable source of energy for the camps, for the children to be able to go to school, but also for the girls and women to feel safe when they go back home in the evening. And these are only one of the many examples that we were able to identify. We also launched a global online hub where you can find the agendas, the resources, the lived experience stories, not only of the burden of mental health driven by climate change, but of the resilience that they were able to build with the communities coming together. But my question here today is how can multilateral fora place global health and the impacts of climate change on health and rebuild the trust in this new era of global health that we are entering? So I would like to highlight 3 key challenges. The first one is around our fragile healthcare systems. Globally, many people are dying, are losing their lives to preventable and treatable diseases. The medicines, the vaccinations, and the treatment are there, but far too few have access to them, are able to afford them without having out-of-pocket expenditures. The second challenge I want to highlight is the health workforce. It is inadequate and insufficient, and as you can see in this graph, how disproportionate the health workforce is right now. But WHO projects that by 2050, we're going to experience a workforce shortage of 10 million doctors, nurses, and physicians worldwide. And when it comes to the funding, as Her Excellency, the Minister highlighted, we have seen the withdrawal of the US from the World Health Organization. And what that means is that the shortfall in finance threatens to weaken the already fragile healthcare systems, especially in low middle income countries who are already in debt stress, will be unable to either rebuild because of climate-related events that are destroying healthcare facilities, or responding to the increasing outbreaks of infectious diseases that are also driven by climate change and environmental degradation. But it's also very inspiring to see the incredible leadership of the South African G20 presidency, their health agenda, which has also addressed the healthcare systems, the healthcare workforce, as well as access to essential medicines in its priorities. And to address these challenges, first and foremost, the finance. One of the key areas that are being discussed in the UN General Assembly last year, now in Davos, is how can we reform the global financial architecture and the global financing. But I want to highlight something very important. When it comes to financing, not only to multilateral organizations, but to community-led grassroots solutions, which we have seen by identifying these solutions that they struggle for funding, they struggle to access these big multilateral institutions, and to have not only a sustainable source of funding, but to have it flexible to the changes that they are experiencing on the local level. But also, the financial system is so crucial, especially for young nations, not to be constantly living in the past, paying back their debts, but instead investing in their future, in building their education, their healthcare systems, especially during the climate emergency. And also having a scale-up of coordinating not only public financing, but also bringing in the private sector and the private actors, and having that scale-up that is necessary, that is urgent, that is flexible, that can adapt to the needs of the young developing nations. An interesting report that was just published 2 days ago by the Rockefeller Foundation and Foundation Sanofi, which was looking into climate and health financing. And there are good news because financing has actually increased from 1% to 9% over a few years. But at the same time, the financing that is given for countries to work on climate and health is still in loans. Further, more pressure or more debts on these countries to act. And much of this finance, less than 35%, is actually channeled directly to the countries. Another important priority is the health workforce. So not only investing in the education of the health workforce, but creating conditions that are decent and that encourage the retention of the workforce. This is so critical because of the high risks of burnout that many physicians, including myself, have experienced during my own residency. Leveraging the technologies and the power and the incredible achievements we are seeing now through AI and digital health. But a very interesting study that was published this year shows that 80% of the decline in child mortality from 1970 to 2000 has been, across 95 countries, has been directly attributed to digital health technologies. And there's also the importance of training physicians to utilize these tools across developing nations. Very important and for healthcare systems, not only investing in what global healthcare systems are, but looking into the regionalization of the healthcare systems, the empowerment of and creation of regional healthcare centers, but also building the capacity of national and local institutions that can respond to the needs of the communities directly. When it comes to aid, it's important to ensure that there's a national ownership of the aid that is being given to countries so that it decreases dependence, increases sustainability, increases the reliability, but also the relevance of the projects that are being developed to a local country context. While the G20 presidency has set out an ambitious and actionable agenda, and in its main priority, sustainability was one of the 3 keys, there's also the opportunity for sustainability not to be focused only on energy transition and climate disasters, but to also be integrated within the health agenda, and to have a clear link between climate action and health resilience. Because healthcare systems are the first-line responders to the impacts of climate change on the health and well-being of the communities. The health workforce are the first ones to respond to a heat stroke, to an asthma exacerbation, to direct-related injuries, to climate-related disasters, or to a psychological emergency because of the increasing heat, especially in people who are living with mental health challenges and conditions. I'm also very proud to be part of the Lancet Commission on Global Governance for Health. We are looking at addressing the functions, the dysfunctions, the challenges that I have outlined, the solutions to address these challenges, and pave a roadmap forward for a global health governance that centers health equity and security at heart. And Norway, as a guest country in G20 for the 2nd year, it demonstrates a critical role in rebuilding the trust that we are seeing, but also restoring the declining sense of a common purpose, and also its strong belief and support in the World Health Organization and its role in global health equity and security is so critical, and I'm sure Norway will continue to inspire many of us, like myself, many years ago, to get that trust in multilateralism once again. Major geopolitical shifts, as many of the previous speakers have said, has led to the deprioritization of health. And we are now striving to meet the needs of the current generation, and we also don't want to impede on the capacity of the future generation to meet their own needs. So I'm here to advocate for global health equity, but I'm also here to advocate for intergenerational equity. Because the Sustainable Development Agenda is not just a goal that we are working towards, it is a promise that we give to this generation and every generation to come. We owe our children and their children a world that is equitable, that is safe, and for them to be able to not just survive, but to also thrive, because it is their right to health, to a healthy environment that sustains them. And I am because you are is the Ubuntu spirit of not just our interconnectedness with ourselves, with each other, but also with the future generation and with the planet we depend on. Before I end, I know I'm maybe running out of time, but I had one video, if I can show it. Okay. I don't know how we can play it though. Oh, can we play that? Thank you. Thank you. It's okay. It's gonna go. Yeah. Thank you.
People are tired. People are frustrated. Environmental problems are at the low end of the priority list.
I could not sleep at night. I had anxiety attacks, I would say, because you're constantly worried. And also, even at work, I was angry because I'm like, there is no water.
In the capital of India, where, I mean, the last couple of years, the summer temperatures have regularly been crossing 50 degrees Celsius, which is actually unheard of. It's unnatural.
I think identity, indigenous identity, is such a big part of our resilience. And when you take away the land and the forest that is that source of identity, that can lead to a lot of mental stresses as well.
We lived in a constant state of terror that it would spread. We were afraid to go outside. We had young kids.
Who you are, it is not defines you to be a change maker for a better future of yourself and your community.
Thank you.
Thank you so much, Omnia. We will hear more from you, and I will now ask the participants in the panel to find their seats. It's a highly qualified panel, and we will have a discussion over the next 45 minutes, and then there will be room for questions. I know there are highly qualified people in the audience as well. And before the conclusion of the seminar, we have no less than 2 state secretaries who will respond to questions and who will sort of summarize what we have been hearing today. I think we should get rid of this table here.
Okay, thank you.
Kan du dytte den bak? Okay. Okay, let me introduce the panel to you. First, here on my left side, I have Dolores Kotze, who is South Africa's ambassador to Norway since May 2022. She has a long career in public service in South Africa. A warm welcome to you, and thank you for being in this panel. Next to her, Dagfinn Høybråten, who is the Secretary General of the Norwegian Church Aid for another few days. He has had that position for 6 years, and the Norwegian Church Aid is one of the organizations that has commissioned a report that we will refer to later on in the panel. He's a former Minister of Health in Norway, and he's a former Secretary General of the Nordic Council of Ministers, and he's the former Chairman of Gavi, which is one of the main global health initiatives. On the screen, we have Ole Petter Ottersen. Welcome to you from the United States. He's a professor at the University of Oslo. He is the chairman of the board of Sustainit, who is one of the organizers here. And he is a former president or rector at the university, and he is also the chair of a Lancet Commission on Global Governance for Health. And then we have Frode Forland, who is the policy director for global health at the Ministry of Foreign Affairs, which is also one of the organizers of this event. And he has just returned from 2.5 years working with the Africa CDC, which is the African Union Centers for Disease Control and Prevention. And before that, he was the Director for Disease Prevention and Control at the Norwegian Institute for Public Health, where he worked with Camilla Stoltenberg, who used to be the director of the Norwegian Institute of Public Health, and she was a very public figure in Norway during the COVID pandemic. But now she's a director at NORS, the Director General at NORS, which is an independent research institute. And she chaired the expert committee that wrote a report commissioned by NCA and others, and which was published last year. That report was called Norway Can, Norway Should Take the Lead in Halving Premature Death by 2050. That report is also a point of reference. So, as you understand, there's a lot of competence here, and I will try to sort of divide maybe the discussion in 3 parts. First, we have to describe the state of affairs. Then, secondly, what needs to be done. And then, thirdly, what can Norway do in tandem with the G20? But I would like to begin with asking you, Ambassador, as we are focusing on the role of the G20 and what they can achieve. South Africa is now 24 days into its presidency, and it's the first time for an African country, as far as I know. Correct. So what are the South African priorities for the presidency of the G20 this year?
Thank you so much, Tove, for the introduction. It's really an honor to participate in this panel. And I just need to say thank you to the Minister for raising the important issues of health cooperation in a fragmented world. That is very important. And also, we're looking forward to the value of having Norway as a G20 guest country membership to contribute and assist in shaping the G20 agenda by bringing the health discussion forward, as the Minister indicated. At the center of South Africa's G20 agenda is promotion of cooperation. Because we need to understand, and I like your quote, Umrani, I am because you are. There is no way any one of us can be self-sufficient. So it is important for us, particularly considering our history, that we consider cooperation. South Africa's presidency is held under the theme of solidarity, equality, and sustainability. Solidarity is for us to seek a future that is people-centered, development-orientated, and inclusive. In an interconnected world, the changes that affect one nation affects all of us. And I think that if the COVID-19 pandemic really illustrated that, how interconnected world we are. By advancing equality, we seek to ensure fair treatment, opportunities and advancements for individuals and countries, irrespective of race, gender, and any other difference that we may have. Sustainability, once again, I agree with Umrani, is to meet the needs of the present without compromising the ability for the future generations to meet their needs. We couldn't be so selfish to think that we are it. We have people and a generation that's coming after us. For the health sector, the theme is universal, accelerate health equity, solidarity, and universal access. We have 5 priorities for the Health Working Group. It is to accelerate universal healthcare through a primary healthcare approach. Once again, coming back, and it was interesting to get your statistics on the funding for non-communicable diseases, because one of our priorities is to stem the flow and the growth of non-communicable diseases. Once again, it aligns very much with Umrani's presentation as well, where she highlighted the shortage of 10 million health workers. So one of our priorities is to strengthening human resources for health. Then, of course, the 4th one is pandemic prevention, preparedness, and response.
And our president underlined this in his statement on Tuesday at Davos again, where he indicated that within the health sector, South Africa, by chairing and the presidency of the G20, supports the production of pharmaceutical products, vaccines and therapeutics particularly. Our fifth priority for the health sector is on science and innovation for health and economic growth. South Africa's G20 health agenda emphasizes the equitable, multilateral solutions to 21st century challenges. And with the Global Fund's 8th replenishment being a pivotal opportunity to get it right, because as we heard both from the minister as well from our keynote speaker, that funding is crucial. We can have all the plans in place, but if we don't have the funding, it's going to be problematic. Thank you.
And we will talk more about that. I want to bring in you, Professor Ottersen, because you chaired the commission that came out with a report back in 2014. It was focused on health inequity, and you pointed out at the time that access to healthcare is distributed unequally within and between countries. But it was still a rather optimistic report back then in 2014. How does it look 10 years later?
Well, first of all, thank you for inviting me to this very important discussion. I'm sorry I cannot be there in real life, but in fact here in the US we are discussing exactly the same things as are the major topics for this panel debate. So, and your question is spot on. We were pretty optimistic 10 years ago. The Lancet report was published in what we could say was an air of optimism. We thought that we could simply build on the actors, the non-state actors, but also the governmental actors that were at play 10 years ago, simply to foster better cooperation, build on what existed. What we have seen over the past 10 years, of course, as you all know, is a very unfortunate change when it comes to the governance systems. And this is not only true for the global governance systems, but also for many national governance systems. So the new Lancet report, and I'm happy that we have at least two commissioners present today, in addition to Umnia El Omrani. I see Nils Christian Stenset also in the audience. What the new report will do is simply to reanalyze what has happened with health over the past 10 years, taking into account the geopolitical development, and also to realize that today, as has been pointed out already, health is what we could say squeezed between geopolitical tensions, war and conflicts, movement into a more authoritarian state of affairs when it comes to national governments. We have a tremendous democratic backsliding that affects health. And on top of this, we have disinformation and we have distrust, as has been mentioned. And we also have a financial system that doesn't really provide for better health. And in Africa, I have been to Africa several times over the past few months. I met with Frode Forland in the Africa CDC, among other things. What we are seeing is a tremendous debt crisis. In fact, many of the African countries, they spend more to handle their debt than they can possibly invest in their healthcare system. So, you know, there is a need for a total makeover of the governance systems in order to improve health. This is what the new Lancet Commission will be all about. It's not only to reform, it's really to dramatically change the way we govern health cross-sectorally. The last point I would like to say is that I'm really impressed by the statements from the G20 meeting in Rio de Janeiro, because they zoom in on the most important points. Also the One Health aspect, which is so important to really relate human health to climate and environmental challenges. And one thing that we are discussing here now in the USA is simply to see how can we ensure that regions, countries can be more self-reliant when it comes to production of vaccines and medicines. So our minister mentioned a coalition for production of vaccines and medicines, and this is exactly what is needed now, not only to distribute the products, medicines and vaccines, but to ensure that Africa, among others, can be self-reliant when it comes to vaccine and medicine production. This is exactly what we're discussing here now in America. So thank you again for inviting us in, and I really think we should ensure that this discussion will go on also after this meeting. Thank you very much.
We will discuss more in detail what needs to be done, but first, when describing the state of affairs, Dr. Høybråten, I want you to say something about the impact of the Trump presidency. I mean, he has frozen all aid now for 90 days, and they are going to re-evaluate all international aid, and he wants it to be in line with American values, and we know what that means. Can you elaborate a little on the effects of the Trump presidency?
Yes, I think the warning that they will withdraw from WHO was expected, and it will have devastating effects on the global health cooperation, because WHO is the most important platform, as said by several speakers here. And it's not only money, it's all the expertise and all the research resources all going into that cooperation that is drained through such a devastating decision. So let's hope and pray that it will not happen in that way, that there will be some sort of mutual engagement, but it will weaken WHO. Secondly, the freezing of aid for 90 days was, I didn't see it come. I think it was surprising to many of us. And who knows what will come out of it. I think it's pretty sure that massive cuts in aid will be a result, because to bring all that from the world's largest donor of ODA, official development aid, $65 billion a year, or last year measured, it's going to have a draining effects on a funding environment that is already very, very tight. And what American values is, we can just speculate, but we know from last Trump period that sexual and reproductive health will suffer. We will expect some sort of a gag rule again.
Which research shows impacted the health of women. More women died during pregnancy.
Yeah.
And
so it's not the pro-life, it's the opposite kind of policy. So this is something that one can expect, and I would also like to mention that the influence of anti-vax sentiments and lack of respect for research and facts, knowledge-based policies, is something that we don't know how much that will mean in practice, but it's there in the background, and it will eventually come to the front and be tested.
Yeah, we don't really know yet if Robert Kennedy is going to be confirmed as the Minister of Health in the United States, but it looks like it, and we know that he's a vaccine skeptic. Camilla Stoltenberg, this is not only a question of Trump, this is worldwide. We see it in Europe. And your report that you published in November last year pointed to the fact that here in Norway, a lot of funds have now been diverted to Ukraine, which is fair, which is understandable. So how much of a challenge is it? Is it realistic to think that we can increase funding and engagement for global health?
Well, I think it's realistic, but I mean, that doesn't mean we're certain that it can happen. It depends on political parties and how the elections in Norway end and how they're played out before the elections. So I think it's an important point in time to say what we are saying. It was commissioned by Dagfinn Høybråten and others, and our major aim is to urge Norwegian authorities, the Norwegian government and parliament, to continue to be a major force in global health, both because we need to continue to reduce inequality in mortality and other parts of health, but also because we have a common interest and a self-interest in engaging more in pandemic preparedness and preparedness against other health disasters.
Frode Forland, how is this seen from Addis Ababa, where you've been working for the last 2.5 years, seeing that the funding are decreasing and as Omria pointed out, achieving the Sustainable Development Goals is really, really out of reach. How is that regarded from the African Union?
I think I will start by saying this is a great report. It asks for Norway to take leadership in global health. And I think the best way we can take leadership is to give away ownership, to give the ownership to the African countries themselves. Africa CDC is one of the organizations that is ready to take that ownership, and the African countries are ready to take that ownership. There are very weak health budgets in many countries. Only South Africa, as far as I've read from WHO figures, have reached the goal of 15% of the budget on health. It's varying from 2% up to 12%. And I think there is something here by understanding that the world has changed. When we started by aid in the 1960s, by the big funding agencies in the early 2000s, I think there was let's say, a way of thinking in the North that we have to help them in the South. Now we need to find ways of engaging in equal partnerships and finding a way of trusting those well-educated people that we meet in the South who have the shoes on themselves, who knows best what are the requirements and the needs for their own health systems. And I think that report is pointing to a lot of the same things that has been elaborated in the Lusaka agenda, which is about also strengthening health investments in countries, having national ownership, and having a way of also increasing equity by, for instance, also local production of medical countermeasures and vaccines.
But one concrete example, the AU CDC, they are involved in building similar national structures like this, which is something that is seen as a good way forward to have national health, public health structures. What is the status of that work in Africa?
Yeah, one of the main objectives of Africa CDC is strengthening public health institutes in Africa. And the status is that like 1/3 of African countries, they have an independent public health institute. 1/3 is on the way to get one in the process, and 1/3 doesn't have them. And that is a way of strengthening also the science background and the independent scientific evidence-based advice that can be given to the health leaders of Africa. So I think that is a very important way forward. And Africa CDC has been established to support all countries of Africa. And it's under the African Union and with the champion for preparedness and pandemic response from South Africa, Ramaphosa. And I think there is a great opportunity now also to listen to those voices and find a way of also better integrating those big international funding agencies with the local needs and the local structures, and where people can also be in the driving seat themselves. And African people are sick and tired of being run from Geneva. That is the feeling I get from Addis.
Yes, they're sick and tired to be run from Geneva, but they still depend on funding. And Omnia, I want to bring you in on this. I have seen at the United Nations, for instance, there is a lot more African power and manifestation of influence and power. But still, there is this dependence of funding from the richer countries. Do you see that this can change, that there could be sort of independence in, let's see, medium-income countries?
Yeah, I think we are now witnessing an example now with the G20 summit in South Africa, and there's big emphasis from many, not only different African-based organizations from the AU, on the need to change where the big funding institutions are, rather than being in Geneva or in Washington or places that becomes inaccessible. And it's not only the location. What's also challenging is how, for example, when applying for a grant, we're applying for aid, we're applying for funding, if it's not bilateral, which depends on what the nation wants to do and who is the leadership of the country, which you're seeing right now, but if it's not bilateral, if it's through big multilateral institutions, that it's always a challenge when it comes to the paperwork, the application process, years on end to apply for funding from big institutions like the World Bank, like the Green Climate Fund, which brings in a big challenge in accessing funding, especially for small scale and small organizations that are struggling for that seed funding. And that is what we're seeing right now, that the needs for global health is far less than 50% met by the funding. What we're seeing a rise in philanthropic organizations that are coming in, but there is a need, and this is why in the UNGA, when there was at the end of September the Pact of the Future, and one of the main pillars of that pact is the reform of what that architecture looks like, but there has to be a way forward beyond talking about it in events and in panels and in speeches, that we need a reform. How are we going to actively do that reform? And what does that reform mean for a low middle income country? What are the challenges that the organizations, the countries are facing? And a recent World Economic Forum report was saying that it's not just aid, it's an investment in health. Health is as important as investment in energy, in education, in technology. It is a human capital investment and has to be hand in hand with the major investments, because many transition investments, they look on what is the return on investment. But for health, it is so critical for any development to take place, for any of these big priorities that are being, for AI to take place, for digital infrastructures to be developed. Health must be central to that.
Yeah. Høybråten.
I wanted to comment on three things. First of all, I want to underline what Ole Petter Ottersen said about the big structural problems and challenges. That is, if we can't fix the debt crisis and reform the broken global tax system, we can put as many dollars into health as we want to, but it will just be a big black hole. So African leaders have taken the lead to reform the tax system of the world. And they have achieved support from a vast majority of countries in the UN General Assembly. So I think that's something we have to bear in mind. Secondly, Norway's role. I think I have been observing Norway's role and been a part of Norway's role for 25 years. And the fact that Norway is seen as a leader in global health today hasn't come overnight. It's elements of the building of that role has been providing funds, yes, but it's been also providing leadership, expertise, innovations, like we've heard of today. And I must confess I'm a bit worried that this is taken for granted. We heard from the South African ambassador that health is actually one of the reasons why Norway has been invited in as a guest country in G20.
Okay.
That is something that one should take note of. And thirdly, we have to look at what are the drivers for public health and building of public health structures in country. And it's national ownership, it's national, the countries being in the driver's seat, but it's also supporting public health interventions that really drive the building of the local clinics, the local platforms, not only the institutes and the institutions.
We have a lot to go through, but Ambassador Kotze, how do you see this building of structures, building of tax systems that could create a sustainable health system in Africa? How do you see, is there any progress?
Well, maybe before I respond to your question, I just wanted to underscore that there is sufficient development, maybe not sufficient, but there has been development on the continent, especially with regard to the vaccine manufacturing facilities. Yes, South Africa has one that's running, up and running, but there are 25 that are in different phases of progress. Coming back but at least that also then shows how the continent is ready to tackle its own problems. And we really appreciate the global assistance that we have, the role that Norway is playing, particularly now through the Johannesburg process as well, and the work that they're doing at the CDC. With regard to the funding and what is required, I have to come back to our speakers to say that, and that is why debt restructuring is such a crucial conversation as part of our G20 presidency as well, because you can't have a country spending 80% of its national income on servicing debt. What then is going to happen to public goods? So then we come back and then we ask for those that we're paying to say, but now you need to give us aid so that we can build. So let's look at the debt and the financial architecture.
And China is an important actor here.
Amongst many others, yes, that's correct. That's correct. Yeah, but the difference is that if you have a conversation around that, and that is why South Africa is so in support of also looking at the relooking of our financial architecture as we know it, the Bretton Woods system. It is because in many instances, China will not have the same conditions that you would normally have through your traditional processes.
Yeah.
And then that sort of give some of the recipients a sense of ownership, where they can apply and how they can apply the money.
Camilla Stoltenberg, you had a comment?
Yeah, that was a comment, an earlier comment to your remark about health or investing in health is an investment. It's not a donation. And that's the basis for our report also. It's based on the Lancet Commission on Investing in Health, which is the third commission on that issue. And all of them had great impact, and we're hoping that this one will also have a great impact, because it is an investment not only in the health of the people in the countries that are poor and cannot make those investments fully themselves, but also for the whole world and for ourselves. So it's our self-interest that we are pointing at, in particular, to urge Norway to keep up the role, not because solidarity isn't important, not because we cannot give away money, but because we think that is an important driver for getting the broad support that is needed in order to mobilize both in Norway but also in other countries that need to mobilize at the moment, because there is a trend towards less engagement in building or investing in health across the world, and that is worrisome.
Would you say that investing in health is just as important as investing in weapons to defend ourselves?
Absolutely.
Ole Petter Ottersen, I will bring you in. Antonio Guterres, the UN Secretary General, he has expressed concern over fragmentation in the world. And he has called out the multiplicity of summits and with power more diffuse. And of course, he's sort of defending the role of the United Nations because he's Secretary General. But he has a point, and different countries, they exert influence in different spheres. And South Africa is a good example as a member of BRICS, of the G20, the G77, and so on and so forth. Can global health initiatives within the framework of the G20 undermine the work of the United Nations and the WHO, which is regarded as the most important? What do you say to that, Professor?
Well, what we are discussing now is simply policy space for health, that health gets the attention it deserves from the actors that govern over societies at different levels. Of course, your question is very well placed. But I think that G20 has such a fantastic opportunity now to create policy space for health through the immense financial resources that the G20 is responsible for. So if the communication is in place between the World Health Organization and G20 so that they can sort of reduce the fragmentation that we see at the global governance level, I don't think there is any argument against G20 to engage. And in fact, again, when you look at the report from Rio de Janeiro, I think they touch upon the most important issues for the future of health worldwide. There is one very important point that I think we should go back to, and it has been mentioned also by the minister, and that is that something radical needs to be done with the global architecture. Because what we are seeing today, and I've witnessed this close range over the past few years, working in Africa also, is that many initiatives are taken, and when it comes to focused challenges in health, vertical initiatives or focused initiatives, we're providing vaccines, for example, or medicines, or going for particular health problems. But, you know, what I've seen close range is that far less investments are being done in order to create the horizontal system, a sustainable healthcare system, for example, in Africa. The horizontal dimension is sort of hurt by all the investments that are being done in the more vertically focused initiatives. For example, what has been mentioned now several times is that there also by UNIA, there is a need for research in Africa, in low and middle income countries. There is a need for development of skills. If you look into the competence report, and Frode knows all about this, you will see in Africa, you will see that you need to educate 10,000 approximately, at least, new personnel with the skills that are required to build a sustainable system for vaccine production. So a very unfortunate thing is that money is being invested in initiatives that do not necessarily help build a sustainable horizontal healthcare system in the different countries that we are talking about. So this has to be changed. Research, education has to be supported by investments. And what we are seeing is that this doesn't happen today. Many of us now are working in order to do exactly what Frode Forland says, to ensure that Africa can be more self-reliant, but money is not directed in that particular direction.
I'll give the floor to Frode Forland, but I just bring in another perspective as well, because several have asked for a reform, a necessary reform or restructuring of the global health initiatives. And then we are talking about Gavi and the Global Fund to fight AIDS, tuberculosis, and malaria that have achieved amazing results. They have saved a lot of lives, and Norway has contributed to these funds over the years and has been a main actor. But has that been too much of a top-down approach? What do you think?
I think it was the right approach when they were started, and there is a time to reform them. I think we have to really applaud the results from those investments. And I think also there is, as the minister was saying, a need to think of how can we best ensure that also the countries themselves are able to do this work on their own financing. It's impressive that I think it's 17 countries that have been graduated from Gavi. 19 now. That have actually been able to take over the responsibility themselves. And there is a kind of process in Gavi where they are having first investments and then reducing them. And also the way of doing that is something that we can learn from. I think also in the Global Fund for AIDS, TB, and malaria. And there are ways of thinking of how can we strengthen the health systems to be reliable for all diseases, all communicable and non-communicable diseases. And the report here from Camilla Stoltenberg and her group is talking about what they say in the Lancet Commission. It's possible to reduce premature death by 50% by 2050. which is death before the age of 70. And then you have to invest in maybe 8 infectious diseases and 7 non-communicable diseases, which is a broader health system approach. And give one example, we've just seen a very scary outbreak of the Marburg virus in Rwanda, which is the sister of the Ebola virus, which took 11,000 lives in West Africa. And now in Rwanda, with a rather strong health system in an African context, with a strong minister of health, who is actually also the head of the pandemic fund, they were able to stop this outbreak by 66 cases, 15 deaths. And now we've heard there is a new outbreak coming up in Tanzania. And this was by investing in the health system many years ago. That gave results in contact tracing, in giving good also treatments, and also having the international community on board on testing vaccines and treatments in that situation. We've said a lot about learning from COVID, you know, and what Africa learned was that they cannot rely on the global north when it comes to vaccines. They were not there when they were needed. And we see the same now with the Mpox outbreak. The Mpox outbreak was rolling on in Africa when it was blown off as a health crisis by WHO in Europe. And it's still numbers, more than 5,000 new cases the last 2 weeks in Africa, 40 deaths. So there are still things to do and ways of looking at this from a point of view of living in a poor country or a low and middle income country.
We have already talked about challenges for Norway and what Norway should do, and I think it's you agree on that Norway should continue its important role internationally. And, but Dagfinn Høybråten, is there a prospect for more Nordic cooperation as well within this field to sort of build a Nordic strong driver within the global health?
If you'd asked me before the pandemic, I would have said definitely yes. Now I'm more in doubt because the pandemic really was a breakdown of Nordic cooperation in general and Nordic health cooperation in particular. But I think there is a learning process from that gives hope that the Nordic countries can take on more of a coordinated role, also globally. I want to quote the report from Camilla Stoltenberg's expert group when we're talking about reform, because the committee recommends reforming global health initiatives, but says also that global health initiatives must increase, not decrease. And I think this either-or kind of perspective that we heard a bit of in this debate is not valid, because there is experience within the global health initiatives to build on. And I would recommend the representative of the MFA to read the fresh MOPAN assessment of Gavi, which says the following: Gavi's work to broaden vaccine coverage and strengthen health systems is particularly critical. It focuses on reaching children who have not received vaccination and serves not only to combat vaccine-preventable diseases, but also to provide, quote, a crucial platform for delivering other primary healthcare services. And it also says that they repeatedly has demonstrated its ability to be responsive to country needs by closely aligning with country strategies and priorities, incorporating country systems and collaborating closely with in-country stakeholders. So let's not forget those tangible results. If it was just a production of vaccine and distribution of vaccines, 1 billion children wouldn't have been vaccinated over these years. So it has happened, and it has mainly happened through national immunization programs and facilities.
Stoltenberg.
I think an interesting difference between now and when those global health initiatives were established is that now it is possible to measure a lot more. And that has been a basis for how they've been rolled out and how they've managed to succeed, because they've been able to measure the results and show them and sort of steer their activities according to that. Now you can measure a lot more, which was much more diffuse and difficult before. that means that it actually makes it easier to use those mechanisms in order to assist in developing the healthcare system as well, or the health system overall. And primary healthcare has been particularly difficult in earlier times to measure the effects of, but now I think it's much easier.
Can I jump in to say we have the system for measurement here, actually also developed in Oslo, this district health information system. So I think it's also a great asset of a health system to have such a kind of surveillance possibility that it has been rolled out from the University of Oslo.
There is a person, Gianluca is here with a microphone, and we can, you can get ready, prepare your questions, and please questions, not lectures, and they should be short, because we have very little time. And also when you ask questions, you have to introduce yourselves and say a little bit about who you are and who you represent. But I just want to bring in, Omrani, you mentioned new technology, I mean, following up on what you're saying, and we have artificial intelligence, which is really, really developing, and at the same time, a deficit of 10 million health workers by 2030. You would probably comment on that, but I just want to ask you first, is that also something that the G20 will address this year?
Well, two of the priorities under health. The one talks about the health, the investment in the health workforce, and very definitely our fifth priority under health is on science and research, which is very important. And with the rapid changes in technologies, but even just in the mutation of diseases and how people adapt or whether they can or can't. So it's very definitely aligned already. It is in the priorities.
Do you think that is a path forward to work with the G20?
Yeah, I think it's so critical. It is an incredible opportunity to understand, especially now, there's a big global dialogue around the use of technology, the regulation of AI, but in the health sector it has been so transformative in diagnostics, in treatment, but also it is so urgent now because with the climate changing and the disease burden is shifting, it is so critical to have these technologies to build effective early warning systems so that we as a healthcare system not only respond to emergencies, outbreaks of diseases or climate disasters, we actually anticipate, prepare, as we have learned from the pandemic, by having these early warning systems, which is a key priority as well this year and the year before for the UN Secretary General, around the investments in early warning systems, which is the health sector is a key actor for that investment. And one thing I also wanted to come on to before is around primary healthcare centers, because last year's G20 presidency in Brazil has one of the exemplary primary healthcare centers, and it's very inspiring to see that continuation with the South African presidency. But it is important when we're thinking about healthcare system is also to consult the health workforce and understand what their needs are. And also with primary health centers, for example, in Egypt, we are now trying to train more primary health practitioners, so not only to provide the facilities, but also to provide a workforce that is ready to, that is interested, that is motivated, but it's also ready to tackle primary health care.
Raise your hands if there are questions. Okay, we start right there.
Much. You hear me?
Yes, yes.
So I'm Gustavo. I'm the ambassador of Peru. So first of all, Tuve, you're a fantastic moderator. Your questions were very inspiring and thought-provoking.
Thank you.
Thank you very much. Latin America has not been mentioned during this occasion. And as a Latin American, I would like to make some question requests.
Yeah, keep your microphone as close as possible to your mouth. Yeah.
To G20 and also to Norway.
Yeah.
G20 to ensure that countries that are not members of the G20 could be included as observers in consultations regarding the global health, such as Brazil did with during their presidency for some of the committees. So I encourage you to encourage members of the G20 to follow that on a regional basis. And to Norway, there's no strategy for Latin America yet. I mean, there's one for Africa, and I could easily know why Africa is the main focus, because they are more on it. But Latin America is still on it, and I would like to ask, how can we come bilaterally to Norway to request support in the areas that have been discussed today? Thank you.
Excellent, thank you. That last question, I might bring that over to the state secretaries afterwards, or if, I mean, you might want to respond to why. So no, okay, well, let's pose that question to one of the state secretaries. But you will ask on Latin America at the G20.
Yeah. South Africa is always, in terms of the positions and the multilateral arena where it goes, is that we always look at the region. So, for example, we've invited all 5 regional economic communities to be as part of the G20, as well as we've invited, for example, Egypt as a guest country as well. So we have individual African countries, and I trust that Brazil has done the same when they were chairing, that we take that regional approach. But the request will go through.
Excellent. Okay, next question right here.
Hagen. I'm the Secretary General of Forut, which is a civil society organization in Norway, working with alcohol, drugs, and ill health, mental health as hindrance for development. And it has been a wonderful time to listen to you and to raise global health. And thank you so much, Omrani, for really highlighting the NCDs, the non-communicable diseases, and also the risk factors as pollution and the consequences to, for example, mental health. And the key word for my question is the prevention and the commercial determinants of health. Because how can we, as countries, but also in the multilateral sector, how can we support the countries to work on politics that really support public health and counterforce the global industry of alcohol, of tobacco, of pollution, of sugar, and all these things that really are preventable, but that we as civil society, as well as in the countries that we work in, we know that these counterforces every day try to hinder the countries to put on politics that support public health. Thank you.
You're asking that to Omrani?
First Omrani, but please.
Yeah, well, you can start commenting on that. And then next question will be in the back, but you can respond to that.
Yeah, thank you so much for your question. And it is very challenging to implement policies, and I've worked in several commissions, and we've always identified the challenge of how can we, for example, tax sugar or certain policies that would actually protect people from the factors of non-communicable diseases and the lobbies that we are seeing by the private sector in government that keep pushing these policies. But what was also inspiring on the other hand, for example, in the climate change space, we've been advocating every year during the climate change conference. We find between 2,000 to 4,000 oil lobbyists that come to negotiate and come to stop the climate. And then we look at the NCD community and see how, for example, the World Health Organization was able to stop big tobacco companies and pharma companies from coming into the discussions. So there is one positive way, but it also, how can we translate that into local governments? One thing I would give as something that has inspired me is I was part of a medical student organization that represented over 1.3 million medical students across over 140 countries. And we've done incredible work with different civil society organizations, with government. For example, I worked with the Egyptian government and Ministry of Health, and we launched a big campaign for diabetes across 10 cities across all of Egypt, and it has been continued until now. That was 5 years ago. So also working with youth-led organizations that work on non-communicable diseases can also bring a lot of push with civil society for governments to not only do awareness and empower individual choices, but to also translate that into actionable policies and hold governments accountable for not passing these evidence-based policies through to governments.
I just want to bring in Dagfinn Høybråten. You might not know that, but he is sort of the father of the prohibition of smoking indoors in Norway. That that was imposed when he was a minister. Do you have a comment on this?
Well, of course, but I don't know if you want me to go on that. No, I'll make it very short. I think, yes, there is a role for civil society. Currently, Norwegian Church Aid is trying to influence the political parties' program work. We evaluate them halfway, and then we give them scores at the end. That's one way to do it for a civil society organization. But when it comes to tobacco and alcohol, I think it's a really good case for global health cooperation. Because what we did in Norway was coherent with what Gro Harlem Brundtland did globally. And Norway supported the development of the first and, until now, only convention on global health, the Tobacco Convention, which has inspired countries after countries to do what we did, to regulate, to restrict, by setting some global standards. And I think that could be done in other of these areas of non-communicable diseases. So the case for WHO these days is so important.
Do you have a comment on that, Ambassador?
I just wanted to say South Africa is at the same place. We have also now banished public smoking. And 2 years ago, we've put in a sugar tax because of the increase in diabetes. So the role of civil society, as well as how it influences in the conversation on public policy, we've seen that happen in South Africa as well.
Okay, as we are taking one more question back here, we should have mics on the state secretaries on the front row here. They are soon to come on the stage. And yes, go ahead.
Thank you so much. Joseph Knoll, a professor for digital global health. What are your suggestions to overcome the digital divide when we know that 95% of the unconnected people of this world are living in low middle income countries, where we have the gender divide, the rural divide, and we see the lack of access to information on health?
Who did you ask the question to? Someone in particular? Okay. Okay.
No,
through the, yeah.
I think that there is a great, a very fast movement in Africa on that. As I see it, I've been working as a district medical officer in Zimbabwe before, and now I've been 2.5 years based in Addis Ababa. They have jumped directly from what I'm doing now, writing in a book, until using everything on the mobile. They dropped the whole PC level of working. And I think the build out of structures there is also giving us huge opportunities for the future. But I think there is a need also to invest in digital health, definitely, and to find ways of doing that as a source of really meeting the needs of all people. And I also wanted just to comment on the question of the smoking. In this report and in the Lancet reports laying under it, the most cost-efficient intervention of all is reduced tobacco in all countries. And still, we have also, during the looking at the sustainable development goals, I think 9 of those 20, maybe 10, are determinants of health. So we have to really work across society, and that is the way to work both outside and inside the health system. And working also on digitalization of health is a key issue in that regard.
Oh, there is so much more to ask you, and this could go on for a long time, but we still have some questions for the politicians, so we should bring them on stage. So thank you so much to the panel. Thank you to Professor Ottersen in the United States.
Very good. I loved your report. I've been reading it for the last few days.
So for the last leg of our... Yeah. So I will invite the two state secretaries on, which is Björg Sandkjær, who is the state secretary at the Ministry of Foreign Affairs, working closely with the minister who was here, and Usman Ahmad Mushtaq, who is the state secretary of the Ministry of Health and Care Services. Welcome to both of you. And Mushtaq, you have your microphone ready. Yes, come along. And yeah, let's start with you. You are at the Ministry of Health. You are, I don't know whether you personally or if it's a minister, but the ministry is responsible for negotiating on behalf of Norway for the treaty on pandemic. And those negotiations failed last year. And now they're starting again, and maybe there will be a treaty ready for the World Health Assembly in May. Is that realistic, you think?
I mean, we know that a lot of things are up in the air. Some of the most important chapters in the INB negotiations, they're locked in. The American factor is obviously going to be unpredictable, but we know already, and they had already signaled that any binding treaty would be difficult for them. So in that regards, whatever the Trump 2 administration does, it doesn't, to that effect, to my understanding, affect the INB process that much. We still have a lot of hopes that we will get to a place by the World Health Assembly where we have, where we have something ready. I mean, what the recent American elections can end up doing is also changing, the countries' positions between, the EU, Africa, and other, countries, also G20 countries which has huge stakes in both R&D capabilities and manufacturing of countermeasures. So it's very uncertain. There is an executive board taking place in WHO in Geneva in start of February. Norway is an executive board member, and obviously a lot of the the roadmap will be getting clear.
But one question about Norway. We have heard several times now that Norway has such a crucial role to play as a global health actor and working closely with the countries all around the world. But in these negotiations, Norway also has to put its interests first, which is closely aligning itself with the European Union because we depend on them for the next pandemic. How do you balance these roles?
That's a good question, and I'd just like to say, I mean, the benefit of being a small country is also the fact that, our own interest when it comes to particularly, I mean, this is primarily, we're talking about R&D capabilities and manufacturing. I mean, this is where, the real money and the financial players, big, corporations come in. We don't have a lot of that. So in that regards, there are not a lot of, we're also interested in getting a strong treaty because right now, I mean, we're also negotiating with the European Union on being part of the health union, and having a strong global backbone would be incredibly beneficial for Norway. And we believe that our European partners are also, keen on seeing Norway as a honest broker. I mean, we have an incredible amount of credibility, both in the global south and in global north, and that's why Norway ends up, playing these key roles. And I do believe that in these treaties, I mean, one of the main articles of the treaty, Norway and Mexico negotiated that together, and we managed to get that done. So I do believe that our interest aligns with interest of most of the countries.
That leads me to the question from the Peruvian ambassador about Latin America and Norway's priorities. Will you increase cooperation with Latin America on global health? Björg Sandkjær.
I think we do have collaboration with the different regions. There was a question about the Africa strategy. The need for a new strategy for our relationship with Africa has to do with an evolving relationship with the African continent that I think we have already evolved with the Latin American continent, in that with the African continent we saw a very strong need to move from an approach where a lot of our engagement has been related to development assistance, to seeing how our relationship with African countries as well as the region is evolving to be one more of commercial interest as well as more political engagement. I think that relationship has already evolved with the Latin American region. In terms of the issues that we are talking about, when we talk about cross-cutting issues in global health, all regions need to work together, and we are also working with the Latin American.
But also, you work really closely with Brazil. That was one of the reasons why Norway was invited into G20 last year, because Norway has close cooperation with Brazil on health.
Yes.
Can I just add on the Latin American context? I mean, Latin America has also a lot of policy innovation to show that other low and middle income countries, particularly middle income countries, can follow, because the health outcomes are so much better, and per dollar spent, the return on investment in many Latin American countries is really great, and that is partially because it has been a top priority for governments there to place public health. I mean, in Brazil, they have such a world-leading institutions like Fiocruz, etc., and other Latin American countries has that too. So I do believe that Latin America as a continent obviously is diverse, but it has also a lot to give to the rest of the world.
But Sandkjær, Høybråten pointed out that one of the reasons why Norway has been invited into the G20 as a guest country is the role in global health, and the Norwegian funding for global health has declined relatively, according to the Stoltenberg report, and they worry that Norway could lose that role. Is that a concern for you?
I think the report and other feedback that we have received from many people in this room is that, one, Norway has over a long time built up that credibility as a leader in global health, and that we should make sure that we build on that to play those important roles that we can, not least in a very challenging geopolitical situation where Norway is seen as an honest broker in, for example, you talked about negotiations in the World Health Organization. So that's something that we are working on. What we see very clearly and what we hear very clearly from the countries that we are working with is a need to look at, and the report from the Stoltenberg group is also very clear, about this need to look at how we rig or set up the global health architecture so that we can support countries that we are working with in building health systems and achieving our sustainable development goal of universal health coverage. And to do that, we are very well placed because we are so central, and we do have that credibility in many of the different actors in the global health architecture, that we can help see how we can work with those important actors that many have been mentioned here on the stage, with Gavi, with the Global Fund, with UNITAID, which Norway created together with Brazil and Chile, actually, a few years ago. How we can see how we work with this global health architecture to make sure that we reduce transaction costs for countries and support that overall basic or universal health coverage and work with systems.
But just to follow up on that, what we know for sure when Trump is president is that funding for everything related to sexual and reproductive rights, health and rights, will be reduced. The UNFPA will be one of the targets, probably, the World Health Organization. And the last time this happened, Norway stepped up and other countries stepped up their funding for that kind of healthcare. Is that possible now, given all the funding that goes to Ukraine and reduction of funding in almost every European country?
I think there are two things. First of all, we don't know. We know that the US will pull out of the World Health Organization. We don't know yet what will happen on these other areas. It's true that every Republican government has quite immediately after taking power introduced different variations of what we could call the Mexico City policy or global gag rule, so withdrawn support for sexual and reproductive health and rights.
Is, yes, not supporting anything that has to do with abortion.
Exactly. That hasn't happened yet. So we'll have to see I mean, we can react when we see what the decisions are. What we know is that there is a 90-day sort of moratorium. The government has given itself some time to go through their investments in development, including in global health, and we'll see what comes out of that. I think it is important for us to see where we can work together to strengthen systems, for example, and we hear some positive signals in that regard. But we are ready to make sure that we provide support in those areas where we hear that strong need from countries, including in sexual and reproductive health and rights. But in terms of budgets, I can't make any promises now.
No? Okay.
But we are following the developments very closely. And of course, in general, the pushback against gender equality, the pushback against very key services and rights within sexual and reproductive health is of great concern for us. And of course, we will remain, committed to forwarding.
Mushak, you have worked at the WHO. Do you see, I mean, Trump hasn't, he needs a year before the United States actually can withdraw. And he has sort of suggested that it might not happen, but the way he phrased himself. But can you see any way of reforming the WHO in a way that could sort of please the Americans sufficiently so that they stay in the organization?
That's a tough question. I mean, look, it's going to be obviously a tremendous loss for WHO if the Trump 2 administration ends up pulling completely out, both money and technical resources and so much more that comes with it, and also their political leadership. Actually, the Americans is the one country that push for reforms within WHO quite heavily. They lean politically quite heavily on that. So having them on the outside is going to be a challenge. But for Norway and our priorities, obviously reform of WHO is still going to be high on the agenda. We think this is obviously a problem, and this problem can be converted into an opportunity. So that's the way that we're looking at it. But we are still in early days, and we have. Whether we like it or not, we are still in the executive board. We have a role to play, and we will make sure that we play our role in a good way. I just want to say one thing on the G20, because this is interesting. I mean, G20 is obviously a constellation that some countries that are outside saying, it's not like the World Democratic Forum because you have WHO, but G20 is increasingly playing a major role on global health, and the fact is, next year. U.S. is going to take over the presidency, and the collaboration between South Africa and the U.S. on this matter is going to be really, really important. And there might be a lot of silver linings that we might see with which we don't know. And our priority will be to support the South African presidency. I mean, that's why we are. We were invited by the presidency to join G20. Look, the fact is, Norway has a prime minister, a minister of development, a minister of foreign affairs, and a health minister that are acutely aware of the global health challenges, that are, in prime position to also look for political solutions for, the challenges that we're seeing. I think I am not too worried about, Norway's position in global health. We are, I think we're sitting quite well. However, we have a large responsibility, and that needs to be forvaltet. What's the English word?
Managed.
Managed in the best possible way, and our political leadership fully understands that.
But Sankar, the G20 doesn't have an implementation power. They don't have, as like somebody pointed out, they don't have any money to put into health work. Isn't there a lot to juggle here? Isn't it very bureaucratic that you have G20, the UN, all these, and all the health initiatives? It's a lot of bureaucracy in being involved in all this.
I think the G20 is a great opportunity for us to work with important powers and countries on issues that are important to us, and global health is one of them. So we really appreciate being invited first by Brazil and now by South Africa to be a guest country and to participate in the discussion on global health, for example, where initiatives can be taken. But like Usman mentioned as well, the G20 is not a forum where we make decisions. We make the decisions at the UN, but important initiatives can come out of the G20. Some of the very important responses to COVID, the discussion started in the G20. I think it can be a very important convening, a place for discussion, a place to bring in important topics, and a place where we can help shape some initiatives that we bring into the broader discussions on global health. And you mentioned the different bureaucracies and different initiatives. That is a concern to us, and that's why we are focusing now not on creating new initiatives, but on looking at how we can use the existing health architecture and the existing structures to rally around, again, universal health coverage and health systems at country level. That's what we hear very clearly from the countries, what they want. And together with countries in the G20, for example, we see we have a common interest in actually making that difference.
We are running out of time. This has been an extremely substantial discussion over the last 2 hours. So I'll give the floor to Gunnveig Grødland again.
Thank you very much for being here. First of all, I would love to thank all of the people being on the panels and giving presentations for contributing really, really valuable and thoughtful and insightful comments and strategies for the future. One of the things I like to do is to try to sum up super easy and fast what are the most important take-home messages. And I found 2 sentences to that end. And the first one is equal partnership to enable strategic and rational investments between Norway and the low and middle income countries will be key moving forward. The second one is, and I of course have to talk about research because research is super important. So the second one is research and education will be key for building sustainable self-management and resilient healthcare systems globally for the full world. There were so many important points today, but for me, that's how I'm summing it up. All the details I will leave to you, your brain.